Good day, everyone, and welcome to Skytale Insights. Very excited about today's episode as we're pleased to welcome our very own Skytaler, Greg Mahoney, to the podcast. Greg is a senior manager on our consulting team and is actually in Dallas today from South Bend, Indiana. So thanks for being here, Greg.
Great to be here. Thanks for having me.
So, Greg, today we'll be discussing, I know you're getting a lot of questions about this and the general dental community as well at large, but we'll be discussing the coming intersection between dentistry and aesthetics. And I know that you're getting a lot of questions from the community at large, our dental clients as well. And I think you gave me some percentages yesterday, which were impressive. So I don't know if you'd mind touching on that just to maybe highlight how widespread this discussion is becoming. So hopefully this is a timely discussion. And then just in general, maybe can we start broadly? What are you hearing about this from the dental community?
So first, very broadly, a lot of dentists who have built successful practices, multi-location or smaller groups themselves, are considering investments into medical aesthetics as either investing in a standalone platform to be, an investor inside those practices, or offer some medical aesthetic services inside their existing dental practice footprint. And those percentages from our active clients, we see about 35 to 45% of them are reaching out and saying, hey, I'm interested in adding this to my practice. Where should I start? And we even now have clients or prospective clients who are approaching us saying, hey, we're running a dental practice, but we'd love to integrate aesthetics in some way. Can you help us do that? And so it creates this great jumping off point for expansion in general healthcare and retail healthcare at that fact. But now we start looking at, well, what do you want to do inside your practice? What services are you wanting to offer? And how far down this rabbit hole of medical aesthetics do you really want to go down? And it's really interesting to see where they're like, well, I've always considered myself a dental esthetician. A lot of restorative care focused on the use of very lifelike composites in teeth and mixing a lot of composite colors in order to create that perfect dental aesthetic. Especially on the front teeth, on 7, 8, 9, and 10. And looking at those, I think, okay, well, what's the next piece? And some providers have dabbled inside other, toxin placements or fillers. And then I think, well, can I build this out to be a much bigger piece of my practice, and what would it take? And so it's fabulous to be in that position and be a resource for them.
That's great. And that was a great explanation too. So I have a question. You mentioned some of their considerations are, should I do it within my dental practice or should I open a new location? Is there a general preference that you're hearing from them, or do you have a general preference if you had to pick?
I think that if you're staying in the injectable line with toxins and fillers, around the mouth and the face, I think that you can do that very easily inside your practice, and understanding the anatomy and with some courses in education, I think that it's a responsible thing to do, and it can really help add some additional revenue to the practice. I think if you are thinking of med spa beyond those injectable pieces, inside the same footprint may not be a great fit. Are a lot of dental patients who would be the primary kind of inside marketing target for these services, are they really expecting that their dentist is going to do skin resurfacing for them? I don't think so. And so unless you are very clearly branding it separate, maybe it's the same door, but you wouldn't be able to use the same dental rooms for some of these procedures. And if you really are thinking, oh, I have more ambitions for full body med spa services, this is where you really need to have a physician on staff, a clinical director who is going to be there, because the dentist can't be the medical director in those situations. And so partnering with someone who can oversee those services and help provide them. And that's where we end up advising, hey, if you really want to go down that route, then opening up a standalone location for your med spa, for what investments you want to make in med spa, is really your best bet. And finding those educated and experienced providers to join you, whether physicians or nurse practitioners or PAs, depending on state, on who can perform what procedures.
That's great. And let's go down the path of, let's say they only want to do neurotoxin and filler. So in that case, you're generally okay with, you can offer it within your practice. I'm trying to think visually in my mind, what I consider to be the look and feel of a dental practice, what I consider to be the look feel of an aesthetic practice. And then you take, for example, a typical dental practice probably has insurance components to it. Medical aesthetics is private pay. What are some things that folks ought to think about from an integration perspective, and to be sure that I will want to go into dental practice to, get my neurotoxin, if you will, or my filler, et cetera? What are some general guidelines that we ought to consider here when you think of the look, feel, operational flow, private pay, insurance? A lot to unpack there, but what are some good tips here?
Dentists are intrigued, I think, by some of the, additionally, besides just adding that patient service, they're intrigued by the profitability or the margins that some of these services can provide. And when you're offering it to your existing patient base, I think that they're comfortable with you, and so your existing facility is fine. If you want to start expanding to bringing in more patients exterior for these explicit services, those patients who have been seeking medical aesthetic services in the past, they have a different expectation for what those facilities look and feel like. And the typical dental office, the stereotypical dental office, doesn't always fit into that guideline. And so we're thinking about very, very modern pieces, very clean lines, and dental offices haven't always really had that type of reputation, but newer dental office design does fit into that atmosphere. But for an office that hasn't been updated in the last 25 years, there's going to be a struggle with the look and feel that aesthetic patients are really looking for. They want the facility to have the same feel as their own image aspirations with these services are to follow.
It's a great way to put it. And then, let's go down maybe the path of services offered. You mentioned neurotoxin filler. You got into it a little bit of, if you go beyond that, maybe open a separate location. And I'll come back to the doctor comment you made later. But how would you guide me if I'm a dentist wanting to do this? Like, should I start with neurotoxin and filler? Do you care? Should I go get a laser machine? Should I go microneedling first? Do you have any general guidance if I'm dipping my toe in as a progression of services?
There is a whole bunch of options there, Ben, that you just kind of laid out. And, there needs to be a gateway. Jumping in with a large amount of debt or anything like that is going to be risky, more risk averse than I would advise any client on taking initially. And so that gateway ends up being those injectables, because the barriers to entry are low and the risks are low. And so then while you build this trust with your patients, you're able to start providing that kind of full facial consult. What other services that they would be a candidate for. And so now you can be like, okay, well, what about this next time? Or can we add that today? And so they're always kind of looking for what else is inside the scope of their offerings. Then, start to think about, okay, I know the benefits of what some of these other energy-based devices might be able to do, or microneedling pieces might be able to do. And the regulations vary from state to state. In some cases, you might need a tattoo license. In others, you need to be a nurse practitioner or above, credentially wise, in order to be able to provide those services. And so it's hard to say exactly, but really kind of looking at it as that initial gateway is really those injectables. And then after that, if you wanted to get into lasers or something, and there are lasers that are coming out more prevalently in the market now, focused towards dental providers, lasers with lower energy bases or settings, so that others can use them with based in that particular state. And that's a tricky one to juggle here for a broad audience. But if you really are interested in adding these other services, it's a fabulous option to provide. I think there's just a little bit of research state by state in order to make sure that you stay legal.
Okay, so Greg's advice is go the gateway drug route first,
That's right.
which it sounds like it's neurotoxin and filler, aka injectables, and then get into the harder stuff.
I think so. I think there are some words of caution, is that as you start progressing away from the mouth as a dentist, you need to be aware that, hey, your typical malpractice coverage may not extend to treating crow's feet or the 11s. And so, at that point, it's like, okay, well, what are my options? And in some cases, there are supplemental plans that will help cover. The maximums on them tend to be very low, and the coverage isn't super expensive, but it doesn't have the same look and feel as your typical malpractice insurance as a dentist that you typically buy. But if your practice is expanding using those injectables to where you're having a large amount of volume, that's when you may consider hiring a full-time injector into your practice and helping that so that you can help scale the organization. Maybe you just want this as an addition to be kind of a hobby thing that you're interested in. Great. We'll help support you in that. But if you really want to scale this and make it something beyond yourself, I think that's where the real implications of what are those next steps. And that's where involving other medical providers into your investment will help create a big win for you.
Yeah, so that was going to be one of my next questions. So maybe let's dig into that a little bit. You mentioned hiring a full-time injector as an example. I wanted to ask you, what does my team look like at this point? Is it, if I'm dabbling, let's just say injectables, let's stick to that for now. If I'm going into neurotoxin filler, am I using the same dental team that I have, or am I hiring other folks to do certain things? How do I inject?
So on the provider side, when you start expanding beyond yourself and what you're doing as a dental provider, and you are contemplating hiring an injector, you really need a medical director and a physician inside those pieces. We want to be looking out for patient safety. Do the right things for the right reasons, and the good things come afterwards. It doesn't matter what type of client that I'm working with. That's always where we start. It's like, we're not here to cut corners, and we're not doing things just for the money. We do it for the patient care. And if we're not aligned in patient care, then we shouldn't be doing it. And so finding that medical director. And we see in a lot of places those medical directors need to have full ownership, or they need to have at least 51% ownership inside that professional corporation, and then other providers who act underneath them. And so staffing and clinically wise, you're going to have that medical director physician, and then under them, you'll probably have a PA or a nurse practitioner who is your injector. In only a few places where you'd be able to find, not having those types of medical credentials would be acceptable in a state. And then after the provider side, now we're looking at, typical administrative staffing will be just fine, what they're used to inside a dental practice. And I think that in order to launch some of these things, it ends up being not too dissimilar to building out a niche service inside your dental practice. Now, you might be thinking, okay, I really want to focus on building up my Invisalign patient base. Well, what do? You build screening protocols that your hygienists and your dental assistants are using with each patient that they see. And then, maybe next you want to start looking at sleep apnea and TMJ treatments. Well, you're going to do the same thing. You're going to build out screening processes for all of your patients. And then you're going to be working on getting everybody involved in that. And they have to be on board. And that's where it's really kind of that classical change management piece of, hey, we're going to be offering these services. I need everybody to know exactly what we're going to do, how it's done, and how to impact the patient in the way, because we want to present these options to them in the best light and help them achieve the health that they would really like to achieve. And so we're going to be that resource for them. And I think in dental offices, a lot of dentists really get this this reputation of going away to a continuing education event, and they come back and like, all right, guys, we're going to do this now. And the whole team groans. They're like, oh, no, not another thing that we have to learn and do and add on there. But if it's framed properly, you can really create fantastic niche pieces. And so the practices who have been very successful with adding these other sections of business beyond general dentistry, whether it's sleep apnea or it's an implant and denture section or whatever, I think that those are the dental practices that will become very successful in launching another niche. And it has the same feel to it, creating an internal and external marketing budget and plan, an education plan for both patients and for staff, and then understanding and working through the workflow inside the practice so that they know what is the experience that we want to deliver from start to finish, from when that patient first hears about us from another patient or searches us on the internet, to when they call in, to when they walk in the front door. What is the look and feel we want to be presenting? Are our staff members standing up? Are they smiling? Are they greeting patients by name? They're looking at the schedule. They know approximately who's going to come in, and you can figure out with pretty good certainty so that who that person is that's just walking in the door. And so be personal. And those are the little things that make a big impact.
That's a lot. That's great advice, Sarah. I love it. I think it's important to note, you mentioned it at the very beginning of this when we talked about the team, the medical director component. It's very important to note that because you're a dentist doesn't mean that you can own a medical aesthetic practice. And it's very different state by state. And you mentioned this earlier too, but I want to make sure to double click on that. We have to be sure that you look at your specific state guidelines and you abide by those, and you do have the medical director. And some states are even more strict than others, where you have to have a physician on site. Even some are a little bit more loose. So it's very, very state dependent. But yeah, I agree. I think that's definitely step one to get yourself going. And then you talked about some interesting pieces. And I always like to look at history because it repeats itself, right? As they say. And you talked about ancillary tangential services that have already been historically offered within dental practices, right? You talked about implants. I know we've talked about sleep apnea. Are there, and you touched on a lot of these, but if you're focusing on that, are there some good lessons, good, bad, ugly, that you've seen from implementation of ancillary services that you think you want to highlight to be sure, hey, when you go to another service, a tangential service, these are some of the things that you maybe ought to consider that will apply nicely to aesthetics? And again, you touched on a lot of them, but is there anything else that you maybe want to touch on there?
I think that the most critical aspects are the education and getting all of the team on board with exactly what you're going to be doing next. Without their buy-in into what's going to be offered to the patients, there's just going to be a lot of frustration from that doctor who's saying like, why aren't we doing more of this? When I did the hygiene check, I talked to the patient this, but why didn't you guys tee me up for that? And that's where the getting buy-in from everybody eliminates that frustration. And so then you have the whole team focused on adding this as a piece of the business versus just the doctor. And then we're talking about building out the systems and protocols for patient education once we have all of the team on board, because now they feel invested in it, and maybe there's an incentive that's done about how collectively the practice has grown by adding these particular services. And so then we're looking at what's going to be involved, how are we going to be talking to patients about this? And for some, they might find it very difficult. because they've always been so like, well, open your mouth and then I'll comment on what's inside there. But now we're talking about what's on somebody's face. It's like, oh, well, I've been looking at that wrinkle for a while as I've been cleaning your teeth. Like, do I really want to be saying something about it? And hygienists really value the relationships that they have with their patients. And in some cases, they might be very nervous about all of a sudden, like, bringing something up about the way that the patient looks. But I think that if they have the right setup for how to broach those conversations, and in every practice that method may be a little bit different, but opening up, hey, we offer this. Is this something that you've ever considered before? And if the patient provides a little bit of that door opening, then you can be like, oh yeah, I did notice that we could help you with that. But setting up those pieces, I think, are the most important, because the internal marketing engine that we were just kind of talking about, those multiple steps there, that's what's going to provide the biggest growth inside this. And any practice who has launched Invisalign or clear aligners in general, or sleep apnea, or got a bunch of education in dental implants and now wants to do implant-supported dentures or individual units, they're looking at their existing patient base in order to launch that. And so here, the best way to be successful in the shortest amount of time is those buy-in and education phases.
That's great. And then, so yeah, that was all very interesting. I love it. So then, do you see, this is a two-part question. Do you see any, question one, hurdles if you picture a typical dental practice implementing and integrating with aesthetics? What are some hurdles that maybe we ought to be aware of?
I think the first is even, how are we going to usher the experience of our patients? And there's so many things that involve the experience of that patient when they come to the practice. But like we just mentioned, some of that is around the patient education piece, but it's also the look and feel. Make sure that everything is playing the part of what you want to sell. And so those biggest hurdles and where I've seen these fall are kind of, not following those directions of the change management pieces around education. The other is that a doctor and the staff could get in over their head, and they start taking on things that they're not really ready for. And so focus on the education, on the anatomy, focus on the methods of delivery, focus on what are the poor outcomes that could happen, and are you set up to be able to respond to those instantaneously? And if things go south too quickly, what is your escape route? What are you going to do? You have to find care for that patient once you've initiated it, and so what are you going to do? And oftentimes we see the easiest escape route is really in kind of an owner and dental associate piece, where maybe in some cases they're very much new to endodontics, and so they're trying to gain access. And they're drilling and they can't find the root or something like that. And so then they're like, I don't know what to do. And they've already got the patient numb. They've started drilling, and now what? Well, then they go find the veteran on staff and bring them into the room, and they're like, oh, just do this, here. You know what? Step back. Let me do it. And they're like, here's the access. All right, you got your files. Go ahead and get this endo done. In the same way, you want to be able to have clinical resources, if you're moving into medical aesthetics, that you can reach out to, whether those be live resources and people, or their online courses, or other groups that you can be a part of. And so I highly recommend that there's a significant amount of education done so that you don't put yourself in a poor position, then you'll regret trying to add this niche.
Awesome. How about a positive question now? What are some good synergies that you see to where dental just happens to be set up nicely as you integrate aesthetics within a practice?
I think that there's a lot to be said about the appearance of a person with their smile, and there's still more to offer in that area. And so by adding medical aesthetics, they can start brightening everything else around that smile and the face. And that is really what helps promote those fantastic first impressions and the look and feel that somebody really would like to have. You want to look younger, you want to look fresher, and there's something that you can actually do about it. And so now to be able to offer those is just a fantastic synergy in order, and an expansion of service.
Love it. Now, here at Skytale, we call you the professor. I want to ask an oracle question here.
I'll do my best.
If you go out 2 years, maybe 3, how does this look now? Like right now, people are talking about it. Not too many have actually done it or implemented it, but big discussion point. How does it look in 2-3 years? How big, how significant is the aesthetic component within the dental market at large?
So right now, I think a lot of dentists see investment into the medical aesthetic space as a fantastic way to get a return on their money, whether they're providing those services themselves or they're an investor inside a medical aesthetics business. I think that over the future, when it comes to dentists being involved in the space, there'll probably be a little bit more instruction around specific coverage of what they can do and what they can't do. I think that it will take, 5 years or so or more maybe in order for that to be more built out. And will there ever be a dental specialty necessarily around it? Maybe. There's kind of this dental harmonization type of thing that's coming out now, and it's really interesting, and the smile and balancing with the rest of the facial aesthetics. I think that there probably will be more regulation that comes up. We're seeing other states in medical aesthetics in general, kind of stepping up and saying, okay, this is what will be acceptable, and not where it was kind of the Wild West before. And it's the business is picking up so much that it won't be a blind spot. It's going to be picked up on the radar.
All right, we're gonna replay this in 2 to 5 years and see how many you got right here. I bet you it's a lot of them. No, in all seriousness, thank you so much, Greg. Do you have any final points that you want to bring up on this subject that maybe I failed to ask that you think our listeners really ought to hone in on?
I think if I'm a dentist considering offering medical aesthetics, where do I start? Where do I go? And we kind of talked about that as the gateway is injectables. But even before then, evaluating, is this something that my patients really want to? Asking your questions there and starting with what they want and need. Have you identified these needs? Do you have those conversations with your patients in order to almost like pre-screen them before you decide to invest in the education that would be required so that you have fantastic results? And so starting there and looking. I think the next piece is, do you have the ability to get buy-in from your team? And if you historically have, then I think this will be an easy thing for you to introduce. Will this be the entirety of your dental practice in terms of revenue? No, it will not. But if it's something that you really enjoy doing and you know that your patients are really excited about it, then move towards it. Get buy-in from your team and work on expanding in that direction.
Yeah, so do some upfront work and research before you go out and buy a bunch of inventory.
Absolutely. I mean, whether your team or state regulations, do that research first so that you don't get into trouble or it's like, oh, can I return all of these things that I just bought? Like, make sure you get that research done first.
Yeah, I mean, this is why we call you the professor. Well, thank you again, Greg. Really appreciate your coming on and sharing this insight and knowledge. I know you've been at the forefront of this and fielding a lot of the questions, so really appreciate your time.
Thanks for having me, Ben. I appreciate it.
Yeah. We thank you for listening and hope you got some good nuggets from today, and we'd love it if you subscribe to our podcast. Thank you, and until next time.